Hello and welcome. I'm Dr. Israel Barkin, the Medical Director of the Prostate Cancer Research and Education Foundation. Every Tuesday evening at 6 p.m. Pacific Time, we have a call-in show, Ask Dr. Barkin call-in show, and during the show we bring some abstracts and we discuss clinical trials. And today, July 27, 2010, we are going to discuss study of focal cryoablation in low-risk prostate cancer. The purpose of the study is to find out if men with low-risk prostate can have small amount of cancer within their prostate removed by freezing, called focal cryoablation. And this study is sponsored by Memorial Sloan Kettering Cancer Center. As we could see it's a recent study, March 2010. The official title of the study is a Phase 2 study of focal cryoablation in low-risk prostate cancer. So let's go now and look at the study itself. There are primary outcomes. The first one, to assess the local oncologic efficacy of focal cryoablation. And this will be measured by getting negative biopsies of that side. And secondary outcome measures to evaluate the change from baseline in quality of life indicators following focal cryoablation. And I suspect mainly looking at quality of life, having ability to have erection, because this focal cryoablation tends to preserve at least the nerve on one side. So there are two arms here, and you see patients are scheduled to receive focal cryotherapy. After enrollment, patients undergo repeat transrectal ultrasound-guided biopsy, minimum of 12 cores, to confirm the low-risk nature of their cancer. For study purposes, patients must meet the original entry criteria of this repeat biopsy, and we'll talk about the criteria very shortly. So there are repeated biopsies here, and let's see now what are the criteria. So first of all, the criteria, two-step consenting process will place patient in the enrolled studies. One time is after the biopsy is looked at, and second time when the second 12-course biopsy will be done. They will be filling out a quality of life assessment baseline form, and they also will measure the PCA3 and repeat biopsy. So the first step enrollment, the inclusion criteria, they must be men older than 21. Very unusual to have these young age patients with prostate cancer, but these are the criteria. PSA has to be below 10, and prostate cancer clinical stage is supposed to be T1C, T2A. T1C doesn't tell you about how much cancer you have there, but you will see from the exclusion that there is tendency to have only patients that have it on one side and have minimal amount of cancer, which will qualify them actually for active surveillance. Let's look now and see the inclusion criteria of the second step enrollment. The repeat biopsy, no biopsy Gleason grade of 4 or 5, and the cancer has to be only on one side, and no more than 50% cancer in any one biopsy core, and no more than 25% of the total cores. This actually fits very nicely to people that are candidate for active surveillance studies. Let's see the contact here. This is very important. Dr. James Eastman from Memorial Sloan Kettering, and the phone number is 646-422-4390. So for further information, you could call this number, or you could call Dr. Jonathan Coleman, number 646-422-4432. And the location of these studies, Memorial Sloan Kettering Cancer Center, it's in New York, and we have the address here. Thank you very much for listening. Please join us on Ask Dr. Barkin call-in show every Tuesday 6 p.m. Pacific Time. If you didn't have a chance to listen to the show, you could get on our website www.pcref.org and look at past shows on the home page, and you could download to your computer and listen to shows that we had for the last few years and you could search even by subject, topic, keywords. I hope you will enjoy it. Thank you very much for listening. I'm Dr. Israel Barkin, the Medical Director of the Prostate Cancer Research and Education Foundation, and you are all welcome. Thank you.